So I was in a vacation with my family, and I was rushing to the shuttle and trying to catch the shuttle. I twisted my ankle and just felt this awful pain. We did some investigation and I came to Acıbadem. I was hospitalized, and next day they took me to the surgery. Everything just happened quickly. Just 2 nights, I think, I stayed in the hospital.
After slipping down the stairs, our patient twisted her ankle, and because of that she admitted to hospital in her country. And after the first evaluation, a complex ankle injury involving the bone and the ligaments of the ankle was diagnosed in her country. And then a temporary splint was made just to make her ready and wait until the operation. And our patient decided to admit to our clinic after that. And during this admittance, we did the necessary radiological evaluation, and we diagnosed her having an ankle fracture, complex ankle fracture, together with some ankle ligament injuries. Actually, this is something that we really see commonly, especially in young and active population, especially people who are really involved in sports, both in recreational sports and sometimes in professional sports as well. And now, to be able to fix her ankle's biomechanical situation, we need to perform a surgical intervention for her. Actually, this surgical intervention will consist of fixing the bones with applying some plates and screws with different techniques, and also we need to fix also her ligaments, which should not be underdiagnosed because this is very important to make a proper ankle biomechanics. So as long as we are able to control her physical therapy process in our country, she will be able to go back to our country as early as possible. I think we can let her go back to our country after 1 week of the operation.
I'm very grateful to all the team here, all the doctors and the nurses and everyone who has been involved during my treatment.